Welcome back to Health Corner here on WBS TV. With me is Dr. Ogwang Patrick Engel, who is a senior lecturer in the Department of Pharmacology at
Pharmacy.
Oh, pharmacy, yes, at Mbarara University of Science and Technology, and we are discussing the role of natural products,
medicines and
natural
products,
medicines in treating or preventing malaria.
Yeah.
He was telling us the story of how it all started, and we stopped somewhere. Can we move on?
To
you
cut
go
the story,
to National Council.
Yeah, to cut the story short, National Council accepted to fund this project.
Oh, they funded it?
Yes, and I want to thank them very much, and also government for putting money there. And I want to encourage government to put in more money into National Council, let them fund scientists for different programs they have. Because as a result, this product, Atavo, is now helping many Ugandans. The people used to get malaria 3 to 4 times a year.
Wait, what you're showing us, what is that?
These are granules of Atavo. Now, this contains Artemisia annua plant, avocado seed. I told you about the gentleman who was doing avocado work.
Yes.
And lemongrass. So there are 3 plants in this.
Lemongrass,
Artemisia
annua,
and avocado
seeds.
Do you see it like grass here?
It looks like coffee.
It looks like instant coffee, actually.
Yes.
Because we extracted and formulated it into granules that can dissolve instantaneously. And then somebody can drink it in their tea, either milk or hot water or porridge. And they just need to take it once a week. If you take it once a week, by the third, fourth month, your chance of getting malaria goes down to 0.
I see.
Yeah.
And you followed up patients on that?
We studied patients, we studied health volunteers. You know, of course, people don't have malaria, they don't have malaria, so we begin following them and they begin taking the tea in 3 health centers. Kamuchira Health Center in Kabale, Nyara Health Center in Kabere Maido, and Wagagai in Entebbe. Over 500 volunteers for the entire year. And we found that indeed malaria in this group came down to 0 by the 8th month, to 0. Those who are taking it every week.
So you take once in a week?
Once a week. Just once a week.
They will use Fansidar to prevent malaria?
Exactly. They will use Fansidar to prevent malaria. And so, a number of Ugandans now becoming aware of this product. Because we have to produce it now in some quantities and put it in pharmacies.
Now, let's go back to this. You know, we have so many people who are like you. They're doing traditional medicine. They have herbal medicines. But I've not had many of them come up with extracting them to this level. What is the secret behind this?
I think the difference that for long we left the herbalist, those who have not gone through medical school, pharmacy school, to struggle with this kind of work. But now the pharmacists are coming on board. The doctors, in this study, the clinical trials, we had a doctor, Dr. Abraham Omoding.
I see.
He was the one following up the patients to record the episodes of malaria and also look at other side effects while we are doing the extraction and production of the product. So the health professionals now are coming on board. And that's why you're seeing products changing from the crude form into now things that can go refined. And our goal is now to get machines to compress this to tablets. Because some people don't take tea anyway. They can just follow the natural tablet and then they are protected the entire week. So the pharmacists, the physicians need to come on board on research on natural medicines or herbal medicines because they contain compounds that are active and that can help us, again, including diseases like diabetes. I think if time allows, I'll talk about other products that we have developed for diabetes, sickle cell disease, and they are actually working quite well in a number of patients.
There's a tendency for our colleagues in herbal medicine, especially those who are practicing traditional herbal medicine, not wanting to share their knowledge. And they just go and knock things and then they tell people to drink. And they tell you there's no overdose, you can take it's natural. What do you have to say about that? Do you have a dose limit for this one?
Yes, there's a dose limit for this one. Even water, there should be a limit of how many bottles of water you can drink a day. Some Chinese died of excess water. You know, so anything that can kill an insect or a parasite can also kill a person. Actually, there's a saying that drugs are poisons. The difference is the dose. So we have dose limit for this. Every herb needs a dose limit. Now, the secrecy of the herbalist, I can understand why. One, this is their intellectual property knowledge. It's their knowledge. It's their source of survival. If they reveal it to Ogwang, to another person, then they will lose market.
And we have no provision for
their protection.
For protection.
Yeah, and actually government needs to come up with a way of protecting that knowledge. What the Chinese did, the Chinese sent medical doctors and pharmacists to their villages. And then they documented who had what knowledge. And that knowledge was stored in the National Bank of China archives. Then the Chinese protected that knowledge. In fact, they call them Chinese patent medicines. If you go to Beijing, in a pharmacy, you enter like this. 95% are herbal medicines made in China. And the 5% are conventional medicine. But you go to Kampala here, it's the reverse. 95% are synthetic medicine imported from other countries, and maybe a small section are natural medicine made in this country. That should not be the case. So the herbalist knowledge needs to be gathered and protected by government. Government can compensate them. I know many herbalists who are willing for government, not for much money. What Ghana did, they built a school for natural medicine studies, and they told each herbalist, a university actually, they told each herbalist to send a student, say that your child is trained to be a doctor who uses natural medicines. So the herbalists benefit by having their son or their daughter trained. So then they go to lecture, they reveal this knowledge to the students. That's what Ghana did. Ghana can get another model, either compensate money or adopt the model of Ghana, so that this knowledge, because many of them are dying with this useful knowledge anyway, we are losing it. Yeah.
Now, Dr. Gwang, going back again to these crystals that you've put here, they smell really good.
Yeah, it has lemongrass aroma. You know, lemongrass smells nice. I think it's called chisubi.
Chisubi.
That is the oil. We call it essential oils.
Okay.
Yeah, that oil evaporates, and then you can smell it.
Where do you get the funds to get into this?
I told you, government gave us support through National Council. You know, the president supports scientists in this country.
You mean there's a fund from
for
the
support
president?
to scientists? Yes.
Okay.
But it needs to increase so that many scientists can benefit.
Okay.
Yeah, so National Council of Science actually was supported for about 5 years to support scientists, and that's why such things are coming out.
Looks like the packaging is, you know, the way you look at coffee, it is airtight.
Yes. Because
it's all part of that kind of support.
Yes. Every drug has chemical properties. We call them physical chemical properties. In other words, the type of package you keep it in must be compatible with that chemical or that drug. Even natural medicines, don't just pack it in water bottles like this, like some of the herbalists are doing. They just collect bottles, and that's dangerous because they may be reacting. So you need to know what property the chemical has and where are you going to pack it. Like this one cannot react with lemongrass oil because it is gold coated. Okay. But some people can try to pack an aluminum coating, which can react with lemongrass and form another dangerous substance. So this packing, one is that if you present something poorly, nobody will believe in it, isn't it? However good it is.
I agree.
Drugs coming from the Western countries are well packed. And that's why we will trust them. So we also need to present ours. First of all, prove the science is there, then present it properly.
Wow. Well, for some of you who have just joined in, this is Health Corner. We have Dr. Ogwang Patrick Engel, who is a pharmacist and a researcher, and dealing in traditional herbal medicines, but turning them into. Do you call them herbal medicines, or they're now?
I know some people don't want to hear the word herbal. I was discussing with some colleague in Bahrain who said, "But doctor, can't you use another word, not herbal medicines, because we have made our medicine look like something." What? Something. Actually, we're telling them, now there are this one.
We've been so negative with herbal medicines.
Yes, but they are still herbal medicine, because the definition of herbal medicine is that anything in its natural form that has not been purified but used in its crude or natural form qualifies as what? A natural medicine.
But is this one not changed?
No, this is natural.
But these are crystals.
Yes, we extract it using water.
Okay.
And we remove the water, and then we convert it to this granules that you are seeing.
This is very interesting. Do you have any other herbs that you've...
Yeah, I have developed a number of herbs. One of them is a herbal medicine for sickle cell disease.
Which one is that?
This one. It's in syrup form. We make it in honey base, to improve the taste.
Jenna SM.
Yeah, I decided to brand them as Jenna because my mother was called Jenna.
Oh, I see.
Yeah, I'm grateful for her. So this medicine here doesn't cure sickle cell, but it stops the red blood cells from sickling. You know, when they got into oxygen deficiency, then the red blood cells begin to sickle.
They become sticky.
Yes, sticky and exactly. Yes. So this medicine inhibits that changing of shape.
How did you know?
We did laboratory tests. We get a sickle cell child donates to us blood. We put their sodium metabisulfate, which can cause it to sickle, and close the reduce oxygen. Then we put this extract there, and we check under microscope, has the shape changed or not? Then we're able to tell that, okay, this extract works in inhibiting sickling of red blood cell or not. That's how we know it in the laboratory.
This is very interesting.
Yeah, so after that, we go into animal studies.
And you did that?
Yes, we did animal studies. We found that it also improves HB.
HB is what?
Hemoglobin levels.
Oh, hemoglobin, okay.
Yes, that's in layman's language, the levels of red blood cells, which is very vital for sickle cell children. So then we decided to look at also safety profile. We do acute toxicity. What is the dose range?
In animals, in humans?
Still in animals. We begin with test tubes, then animals, before we go to humans. So still in animals, we also look at the safety. What is the safe dose range? How much can somebody take for it to become harmful? So you know where to stop. And then we develop it into doses like this, which people can use. So this medicine, there are over 30 children whom I have followed personally for the last 10 years. Initially, they used to get frequent transfusion, blood transfusion, and crisis, painful crisis. Some of them could not go to school. But over the last 10 years, I lost 2. But the other 28 are working very well. And why did those 2 that passed away? Because of, I realized maybe exam stress, because they died during examination. But others, the rest, have never been transfused and are doing well. And just taken once a week again.
Is this known internationally or nationally? Yes,
Xanthoxylum chalybum, which is the active compound here, is known, the active plant is known internationally. In fact, this is a plant I was talking about, the extract from this plant.
Okay.
The Nigerians also studied it.
Is that what you call wabu?
Omutatembwa.
Omutatembwa?
Yes.
Fagara?
Yes. We get the extract, the active compound from this plant to make this. We also have other you know, it's amazing that we struggle to look for complicated medicines, but one of the most serious conditions in this country is cough and flu. Did you know that?
Of course.
if you looked at the drugs imported into this country, 40% are drugs for cough and flu.
I see.
So we said, why should we export 40% of our money to
yet
other?
We can make it.
Yet we can make cough and flu. So we made.
So what have you made?
This is called Gina DS. It's a very effective medicine for.
The other one was also Gina.
I told you I branded all of them. This is Gina SM.
Oh, okay.
SM as in sickle cell and malaria, because it prevents malaria in sicklers.
Okay.
This is DS because it is for cough and flu. These are just brand names I give them. And this medicine is available in pharmacies. And they also notified the National Drug Authority.
I think let's do this. Let's go for a commercial break. When we come back, we are going to open our phone lines because these are really interesting discussions. I hope you can join us when we open the phone lines. But remind you, if you want to phone in, move away from your TV set, and then you'll be able to make your contribution. Let's go for the break.